Hello everybody, welcome to the Tuesday edition of Video Clips, and as always I have a couple of announcements, and the first one is that it's only 6 weeks before the Wellness Forum's fall conference, and we have such an unbelievable lineup of speakers. We have Dr. Alan Goldhammer from True North, Dr. Colin Campbell, author of China Study and Whole, Rethinking the Science of Nutrition, Susan Levin from the Physicians Committee for Responsible Medicine, Janice Stanger, author of The Perfect Formula Diet, and there are so many, and Laura Theodore, the star of the Jazzy Vegetarian. There are so many wonderful, wonderful speakers that'll be joining us, and it's only $219, which includes 2 dinners and lunch, and boy, have we taught this hotel how to make fabulous plant-based food. So you're going to eat like a king or a queen and learn a lot of cool new stuff and get to meet some stars of the plant-based world and all that. So plan to join us November 8th through 10. And then Monday, October 7th, next Monday, is our next Introduction to Plant-Based Nutrition with Lori Denman, one of our excellent facilitators, who will give you a quick start, how to get started on a plant-based diet, understanding why to do it and how to do it. So with that as an introduction, let's talk about healthy eating, and I want to spend this session of video clips talking about obesity. And actually, this is kind of interesting and not surprising, the feeding habits of infants. This actually starts, we have studies that show that the predisposition for obesity can start in the womb, but this particular study I'm going to talk about deals with feeding habits of infants, which can predispose people to, or children, to have weight problems. So researchers in this particular study looked at data from more than 8,000 families and determined that babies that were formula fed instead of breastfed were 2.5 times more likely to become obese by the age of 24 months. I mean, it's 24 months old, oh my gosh, 2 years, pretty young to be obese. Additionally, there were some other factors. Adding solid foods to the diet before 4 months of age, which we're seeing more and more of, increased the risk of obesity by 40%, and putting babies to bed with a bottle increased that risk by 36%. Part of the problem is that bottle feeding tends to encourage overeating. Nursing babies just stop eating when they're full, and mothers really can't tell how much milk they have left. There's really no propensity to empty the breast, but there is a tendency to want to empty the bottle, and often children are encouraged to finish a bottle even when they've clearly pushed the bottle away and stopped eating. And so the researchers concluded, for purposes of this study, the issue was not the formula itself. That can be, and I've seen some studies that show that too, but it's actually the method of feeding, the bottle feeding, that presents the problem. The researchers further stated that children from lower socioeconomic households are at greater risk of obesity, and that breastfeeding can mitigate the negative association between economic status and obesity. Now, there are a couple of important points that I want to make in response to this study, and the first one is that I think that parents need to be presented with accurate information about the benefits of breastfeeding, the detriments of formula feeding, which are not limited to the information in this study. Increased risk of all kinds of problems, ranging from asthma and allergies to autoimmune diseases and et cetera, as a result of bottle feeding. Now, there are times when there's no choice but to bottle feed. We have lots of members who've adopted children, and I totally understand that. But I really do feel that if the information was conveyed really clearly to new moms about the benefits of breastfeeding, more of them would do it. And then the other thing I want to make clear is that certainly we shouldn't take a fatalistic attitude toward this type of research and say, oh my gosh, some of these kids start off life not so great. They're eating solid foods too soon and beginning to develop a weight problem, so there's nothing we can do. I mean, children who've already started to develop a weight problem at any age can be placed on a health-promoting diet, and the earlier the better, in my opinion. So we certainly can end up with kids with healthy, lean bodies if we do the right kinds of interventions. So I don't want anybody to think that this is a hopeless situation. All right, so while we're on the topic of weight loss, it is a well-established fact that people find it difficult to both lose weight and keep it off, and if you've struggled with this, you know exactly what I'm talking about. In fact, the odds that a person will recover from stage 4 metastasized cancer are greater than the odds that a person will lose a lot of weight and keep it off. Really sad, but true. And new research offers some insight as to one of the reasons why this is the case. Now, this study was conducted in Australia, and it showed that nerves in the stomach that signal satiety or fullness are desensitized as a result of eating a high-fat diet for a long time, and that these nerves don't just automatically return to normal when somebody adopts a better low-fat diet. The study was done on female mice, and I'm not crazy about animal research, but we do sometimes gain some valuable knowledge from it. There were 3 groups of mice. One was fed standard diet, another one high-fat diet, and then a third group fed a high-fat diet, and then they lowered the fat in the diet after 12 weeks. And at the end of 24 weeks, both the mice that were eating the high-fat diet and the mice that ate the high-fat diet and then converted had gained weight, fat mass, and they had increased plasma levels of leptin and insulin. The high-fat and reduced-fat mice had reduced, and this is a mouthful here, reduced tension receptor mechanosensitivity than while the mice eating the standard child didn't. And what that whole mouthful of words really meant is that the satiety mechanism was not working in the mice that had been eating a high-fat diet, even the mice that had converted to the lower-fat diet. So the researchers concluded that a similar response in humans might be why they need to eat more food, why overweight humans need to eat more food than normal weight people do in order to feel full. The researchers were unable to determine whether or not this impairment is permanent or if it eventually resolves, and my guess is that it probably does. I haven't done enough research on this subject to know, but I think the issue, or the reason why I wanted to point this out, is that when people are prepared and know what to expect, they're much more likely to be successful. And so when I talk about how difficult it is to lose weight and keep it off, it isn't to scare people from trying or make them think they can't do it. It's to prepare them for the fact that it's going to be difficult so that they will stay with it and they'll understand that the experience that they're having is actually pretty typical. It's not that there's something wrong with them, it just takes time. And it will be difficult, and you're going to experience unpleasant things, including craving foods that you don't eat anymore and wanting to overeat when you have had enough to eat and things like that. So that's why I'm pointing it out. So anyway, the best case scenario, we don't let somebody develop a weight problem. Unfortunately, it's starting earlier and earlier, as I mentioned in the previous study. There are serious health risks associated with being overweight, so we do have to do something about this, and we're doing our part here at Wellness Forum. So, as usual, pass this on to anybody who you think would enjoy listening to it, and I will be back to you again on Thursday.